Kim, thanks for coming today.
Good morning.
Pleasure to see you again.
Good to see you.
I think I introduced you to Bowen Therapy back about 6 years ago.
Yes.
And then you found out that Sabina here does the therapy, so you, in between massages, now keep getting your Bowen.
Yes, I do.
You do. What's it done for you?
It's done great things for me.
Like?
I'm a big proponent. I think it's great for any kind of pain relief related to muscular pain, particularly. I love massage for feel good, but Bowen works better for pain relief.
Okay. When I first saw you, I forget, did you have neck pain or back pain?
I have neck pain, back pain. I was having this
That's right,
shoulder pain up in here, knee pain.
Well, that's pretty much
It's much better.
much better.
Yes.
Result. You would keep coming for 6 years if it wasn't helping you.
Correct.
Correct, okay.
Yes.
So we're going to do a little demonstration today, and I'm going to show the world how some of the moves are made for the low back, upper back, and neck procedures.
Okay.
Okay, you ready?
I'm ready. Let me lay on my stomach.
So the world's renowned Bowen Technique comes from down under, Australia. Tom Bowen was an Australian who figured it out in the 1950s and 1960s. And the nice thing about it is non-invasive. It's done with the clothing on. I've got a little bit of bare skin here today for the demonstration just to show the muscles a little more clearly. And I'm going to be going a little more firm with my move for just demonstration purposes. Usually it's a little more gentle than this. So my thumbs rest on the top of the muscle. It's called the erector muscle. And I move the skin and the tissues slightly out of the way, and then I roll over the muscle with my thumbs. Then I take my fingers and I do the same thing on the opposite side, and I make a roll over the top of the muscle. Then we come down on the side of the hip with my thumbs, and I go in to the tissue, down to the tabletop, and then roll the muscle gently up toward the posterior buttocks. And this is a same move, opposite side. And that's part A of procedure number 1. I'm going to do part A of procedure number 2. And this is done right at the tip of the scapula. And I'm going to put my thumbs on that little erector muscle, pull the skin laterally, and make the move over the muscle very gently. Fingers on the top of the erector. Move over it, and I'm going to come up about an inch and do that again. And an inch and do that again. And then come right down to the crease of the armpit over one of the rotator cuff muscles called the teres, and make a little move there. And now there's a 2 minute to 5 minute wait rest period. It's like installing software in your computer. You put in some information and then you wait for it to install. So these moves basically do the opposite of the knee-jerk reaction. A knee-jerk reaction is a reflex arc. And when the doctor hits your kneecap, below your kneecap with the rubber hammer, impulse goes to the central nervous system back to the quadriceps muscle, which contracts. But when doing these moves, that does just the opposite. It causes the muscles to unwind and untwist and release and elongate. So that's one of the things that happens. The other is a lot of these moves are made over major meridian points along the meridian channels, and the moves release chemicals, electrical currents from those meridian points. It also opens up the channels so the meridians can flow more freely. In the elongation of the tissues, it allows for the water to flow, the blood to flow, the lymph to flow more freely. So it has multiple effects. In addition, it releases endorphins from the meridian points. And many of my patients tell me that they feel a runner's high sometimes after the treatment, and then they feel a sense of peace and well-being for a long period of time afterwards. As it turns out, the endorphins is one of the mechanisms by which the immune system, central nervous system, endocrine system internet with each other. And last but not least, it balances the nervous system, the autonomic involuntary system, which is the sympathetic, parasympathetic. Many people are in the fight stage. I call it adrenaline or the sympathetic overdrive, and this puts them into the rest and digest phase. And so all of that's happening while the client is processing on the table, and then we come back and put some more information in after the rest period. So this is part B. It's just a little gentle move. It's the thumb. And then I'm coming down on the side of the leg and doing a little move on the iliotibial band. And then on the side of the thigh, iliotibial band. And then these are called the boomerang moves because it comes from down under and they have boomerangs down there. And the boomerang moves are just little C-shaped curved moves around the edge of the shoulder blade and over the top of the shoulder. And a lot of times I'll make these little boomerang moves and I'll feel a little lumpity lump. Then I come back 5 minutes later and those lumps are gone. So that's how I know that the muscle's untwisted and unkinked, because those lumps are the twisted up muscle. And so now we're going to let her process for a couple more minutes. And now at the conclusion of the procedure, I usually tell people what to do and what not to do. And I tell them that don't be surprised at anything they experience, good, bad, or indifferent. Usually people will feel really good for a day or two and then they go back to square one because the body remembers square one. But sometimes nothing happens for a week or two and then it starts to take effect. If they feel good for a week or for a day or two, then when they come back for their second session a week later, that session usually lasts a little longer and they don't slip back to square one. They may regress a little bit. And then usually after 3 sessions a week apart, 80% of the people that this works for are pretty well good to go. And then I encourage them to come back for a tune-up once every month or two to keep the body in alignment and keep everything loose. Now occasionally people will have exacerbation of an existing pain as the body it stirs it up. And sometimes they'll have an old pain that they haven't had for a while come back again. And then another time once in a while they'll have a new pain because the body is rearranging and repositioning. All of those are good signs. They're unpleasant sometimes, but they're good signs that things are happening and things are changing. And so now that's processed enough, so we're going to turn her over on her back and do the last procedure for today, which is the neck. Thank you, Kim. Scoot down by the foot of the table so your head's out of the hole, and thank you much. And these are just little scalene muscles over the front of the neck. And I'm going to take my 2 middle fingers and put it right at the base of her skull on the trapezius muscle, and I'm going to pull toward her ear, and then I'm going to make the move toward the spine. Pull toward her ear, and the moves toward the spine. And that's it. So you can see how simple and non-invasive it is. And it's amazing how it can be so effective as it is for back pain and neck pain and shoulder pain, carpal tunnel, tarsal tunnel, headaches, bedwetting in kids, colic in babies, infertility in young women. It does all of those things, believe it or not. And it really helps sciatica and knee pain, ankle pain. You can do this on a freshly sprained ankle, and they can get off the table pain-free pretty much most of the time. And it's great for knee pain and tennis elbow, all of those conditions. Great for the TMJ. And it's absolutely wonderful for neck pain. I think of all of the things that people consistently get results for is necks. 80% backs, probably 70-80% for the knees, probably 80-90% for carpal tunnel. And so after sufficient weight, we'll come back and do the trapezius muscle right in the middle of the neck. And again, I'm going to take my middle fingers and I'm going to move the skin toward the ear, and then I make the move toward the spine. Skin toward the ear, move to the spine, and I do those in about 3 different places. Okay, and that's basic relaxation procedure number 3. Are you feeling anything happening?
Mm-hmm. I feel it helps me to relax.
Okay. Okay, so thanks for watching my video. Be sure you go visit my website, www.bowenforlife.com, and check out all the information that's on that site. And I have another site that has more information, drmitchellmosier.com. Have a great day. Thanks.